Hello, my name's Stewart. I was treated for throat cancer 25 years ago, and I'm an advocate for patient involvement in research. Today's talk is very much about patient and public involvement in trials during a pandemic. I think it's fair to say we were all very lost. We were a bit confused. We waited around to be asked, and I think at times we were just a bit irritated and annoyed. Now is a time for reflection. Hello. At the outbreak of COVID-19, I think researchers did what researchers do really, really well. They immediately sprung into action. They started to write their ideas for a study. They put it down their protocol. They tried to search funding, find funding, but also they had to get it through ethics committees and get their colleagues on board. This was a huge feat of activity and lots of studies. By the same token, I think we as patients sat back and waited to be called and asked to the table. And I think that's where our place has been for many, many years. So I think there's something about rebalancing the base of this. And so what I want to do in this presentation is explore some of the reasons why it's so important to involve and engage patients and the public. I want to look at 4 things: opinions, communication, utility, mutual gain. In other words, what do people think about it? Am I explaining it properly? Will it be of any use? And actually, what can we learn from each other? Opinions. In a pandemic, in an emergency, it is probably more important than ever to make sure that we've got people's opinions and attitudes towards any study that's being run. It is those insights that can be offered about the language, about whether this seems relevant, whether it's understandable, whether it's the appropriate thing to do. Now, when we look at it, I think there are 2 aspects to this. In an emergency, there are some known patient advocates. They exist in different groups in research, in hospitals and universities with particular diseases. It would be relatively easy to go to those patient advocates. Now, I'm not suggesting that they're the only place, but the first port of call should be to those advocates to say, does this seem right? Could you just check this over? Second thing I think is that, because it's really important that it's not a group of people just like me. So in this pandemic, it seems to me that there were 2 or 3 options we could have used. One is for those early people who were in the hospital, who then came out and saying to them, could we just ask you a few questions? Could we check with you what it was like going through that? How did you feel when we asked you about a study? I think there's a second group that we looked at early on, or we saw early on, and that was people from the black and minority ethnic communities who even early on seemed to be adversely affected. So it would have been possible to get together even a group of staff who work at the hospital and say, could you just look at this research? There was a third group, I think, early on that we saw, and that was those with underlying conditions. Could researchers have gone and spoken to a group in a care home or people with some of those conditions? It wouldn't matter that they were exactly the ones that we're seeing now, but that sense of just checking and double checking. So gathering people's opinions, perspectives, viewpoints provide us with insights that ensure that the quality of the study is good. Communication. The second aspect I see is the importance of communications. describing and explaining something, especially in an emergency, is absolutely crucial. Otherwise, we'll get some people who will sign up for the study without fully understanding it and dropping out. Or we'll have questions that are far too many, far too long, or the burden will be too much to do. So I think talking to and engaging the public in this is an essential ingredient in all of this. And I would just recommend they make it clear, but there are other ways of looking at plain English. I love researchers to bits, but sometimes the language you use isn't the language that the ordinary person in the street would use. Utility. And as I said, we want this research to be not just carried out, but we actually want it to be used eventually. And that practicality, that utility is so crucial. It's about, is this study relevant? Is it an appropriate thing to do? If we did this and it got this result or that result, is that something that you would want to know about? That you would think would be valuable? Is it something you'd want to find out about and read up the results of? So that utility, again, a third string. Mutual gains. What's in it for both of us? Finally, a lot of patient-public involvement is about the input that the patients bring into the research. And I think only now we're really getting a grasp of the opportunity for mutual gains, for that reciprocity, that understanding, that learning that goes on. And the more we involve people and we're out and talking about research, the more the population becomes research active, is able to see where things are fake news or bad reporting or biased reporting. And that is going to be, again, so important. When we look at COVID-19 and we see all the studies that start being reported, how do we sort them out? How do we sort the good from the not so good? The ones that have used robust methodologies to the ones who've been less so in their application. Because that's the bit that people will learn from. So that would be my final point of the 4. So what are the next steps? I think first and foremost we need some sort of guidebook to prepare ourselves, some map and information. I think we need to make sure we've got our up-to-date contacts list, and then we need to gather good stories of where it went well and people might also like to walk. Thank you.